My name is Russ Derry, and I am the Director of Education for Epilepsy Foundation of Michigan, and welcome to our Learn and Share conference call for this evening. The topic for tonight is transition planning, considerations for teens with epilepsy, and we're pleased to have with us as our panelist Dr. Rajkumar Agarwal, who's a pediatric epileptologist from Children's Hospital of Michigan, Jill Mazur Skornicka, who's a parent mentor for Michigan Alliance for Families, and Michelle Brusch, a parent of a young adult with epilepsy. And we were originally scheduled to have Laura Weisz on, who's a young adult with epilepsy, but she is having some health issues. So fortunately, her parents, Mitch and Janet, will be joining us tonight as well. So we'll have a lot of different perspectives to share. So can each of you just briefly introduce yourself and kind of share a little bit about your experience with this topic? Dr. Agarwal, do you want to start?
Yeah. Thank you, Russ, and thank you everyone who's participating in this conference. I am Rajkumar Agarwal. I'm a pediatric neurologist and epileptologist at Children's Hospital of Michigan in Detroit. I take care of young children as well as teenagers with epilepsy, and I encounter the problems with care transition for several of my patients. I have been involved in developing a transition clinic at Children's Hospital along with my colleague, Dr. Luwak.
Great. Well, we'll look forward to hearing more about that. So, and Jill, did you want to introduce yourself?
Yeah, so I'm one of the parent mentors with Michigan Alliance for Families. We're a statewide organization that provides free information, education support, navigating those special education supports at school from birth to 26, because that's the age range you potentially could get services through the school. So I'm one of the mentors in Oakland County, but we are statewide. And I'm also, as well, a parent of a child with a disability who happens to have epilepsy and neurodevelopmental delay, and he's 18. So not only do I do this for my job, but I'm also doing it personally.
Okay, thanks. And Michelle, can you introduce yourself?
Sure. I'm Michelle Brusch, and I am the parent of a young adult who was diagnosed with epilepsy at 7 years old, and have moved through the school system and now is 20 years old. And so I'm just going to share my personal experiences the best I can and answer as many questions as I can for the others involved.
Great. Thank you. And then Mitch and Janet, can you each introduce yourselves?
Yeah, this is Mitch Weisz, and I think much like Michelle, we're the parents of a 21-year-old senior getting ready to graduate college, and we're here just to answer questions and share our experience as well.
Great. All right. So let's go ahead and get started then. So for youth with epilepsy and their parents, planning for the eventual transition to adulthood should begin in early adolescence and should take place in the home, the school, and in the healthcare setting. During this evening's call, we'll discuss the many different transition-related considerations in each of those settings and the epilepsy-related factors that influence planning. So let's start by discussing the transition from pediatric healthcare setting to the adult healthcare setting. Dr. Agarwal, can you start by discussing the key differences between the pediatric healthcare model and the adult care model, and why transition is more complicated than simply switching doctors?
Sure, yeah. So the focus of care, of course, in both pediatric as well as the adult settings is to improve the patient's health. However, there are some logistical and setting-based differences in the two models. The care provision in pediatrics is more family-centered. The consultation focuses not only on the child and the young person, but also on several aspects of the impact of epilepsy on the whole family. The discussion during the clinic visit is often driven based on the concerns or questions expressed by the parents or the caregivers. Either directly or through parent, the neurologist can often communicate with the school, know about how the child is doing at school, which is where the child spends much of his or her time during the week. That helps the neurologist understand the impact of epilepsy and its comorbidities, on learning and other developmental aspects of the child. In comparison, the adult setting is more autonomous, and the young person is likely to be seen alone with a structured consultation. The focus is on the independent individual. The young person sees a physician by himself or herself, and if the parents attend the visit, they are usually expected to remain in the waiting room. Issues that the young adult may face at employment, which may be related to epilepsy or its comorbidities, may not be as obvious to the adult neurologist because they don't really have access to that information usually. The other difference is often during the pediatric years, the discussions around independence, sexual health, career choices, they don't always take precedence, or sometimes something like sexual health may be considered inappropriate in presence of parents, whereas when the child moves on to adult neurology, these are often important discussions that the young adult will have with their neurologist. While in the care of a pediatric neurologist, in addition to routine follow-ups, the parent provides another layer of security. Follow-ups could be sometimes more frequent if there is a concern that the parent or the teacher expresses. In the adult practice, the onus is really on the young person to seek help independently when required. So this will depend on the young adult to have a good understanding of his or her condition and to recognize when they need help. The process of transition is definitely much more complicated than simply switching doctors. I would like to highlight here that transfer and transition are different. Transfer is fairly straightforward. The pediatric physician arranges an appointment with an adult physician, and the patient goes and sees the adult physician. Sometimes a summary of the patient's history or treatment course may be provided, and it's like the pediatric physician says goodbye to the patient and the family. Transition, on the other hand, is much more complex. The goal is to prepare the young person for transfer to adult care. Transition teaching begins as soon as it is clear that the child's epilepsy is unlikely to remit. The goal is to help the patient and the family to understand the epilepsy well enough to allow them to seek appropriate care as issues arise. A true transition of care prepares the patient and the family to understand the underlying disease and everything that goes along with it so that they can seek appropriate care as they move into the adult world. We do know that about 50 to 60% of children with epilepsy have remission of their seizures during childhood, and they may not continue anti-epileptic medications in their, when they are adults. But the other 40 to 50% may continue to have seizures well into adulthood, for a long time. So these are the kids who need transitioning to the adult neurologist, and they would need to be prepared for the transition during their adolescence. The period of adolescence is a very critical and kind of a vulnerable period of maturation for the child. This is when the individual begins to prepare for an independent life, employment, driving, physical relationships. They go through challenges involving self-identity, autonomy, body image, relationships. They may have questions that they ask themselves, I'm not doing most of the things that my friends do. I can't drink. I can't have late-night parties. I can't take up jobs that I would want to take. They feel often that their autonomy is threatened. They are worried about things like that they cannot do without supervision. They can't take a bath, or I can't swim, or I can't stay up late, and so on. These teenagers are taking pills every day. They have doctor visits, get EEGs. So they sometimes have a perception that there's something different than their peers. During adolescence, body image is a vital process. There may be concerns that the seizure medications are affecting their weight or causing hormonal changes. Often there's a concern that if they have a seizure at school and they wear their pants, then what would their friends think about them? There are concerns, that patients have expressed in various studies where they feel that they may not be able to go on a date with anybody, or they may not be able to find somebody to marry them. So these are all real issues. There is one study. This was back in I think early 2000s, where they surveyed a big group of high school students. These were students who did not have epilepsy or any other chronic neurological condition, and they asked them about what epilepsy is. And it was interesting that only about 50% or so thought that epilepsy is not a mental health problem. About 50% were uncertain if people with epilepsy could drive cars or marry or have children or work. About 50% thought that people with epilepsy die during their seizures. Many were not sure if epilepsy is contagious. So it is not surprising that adolescents with epilepsy have problems coming to terms with the attitudes of their peers. Now, we would think that teenagers with epilepsy have a better understanding of the disease. However, a few years ago, we did actually a study at our center, and we gave a questionnaire to teenagers with epilepsy, asking them questions about the facts related to epilepsy. And the average score that the kids got in that study was about 50%. We saw that they had a poor understanding of lifestyle practices like swimming or sleep deprivation or alcohol use. Many thought that they could stop their seizure medicine if the seizures were well controlled for a few months. We saw that adolescent girls with epilepsy lacked knowledge about the impact of epilepsy on reproductive health. So it is definitely a much more complex process than just finding another doctor, going through the physiological changes of adolescents, understanding the disease, and eventually transitioning to an adult physician where there is much more independence, decision making involved. Definitely is much more, and we have to prepare the child as well as the family for that.
Okay. So can you first talk a little bit about when transition planning should start in the medical setting, and then just highlight some of the key discussions that need to take place and decisions that need to be made. And you've obviously touched on many of these already, but any other key things? I guess walk us through the timeline in terms of when adolescents should be talking with their pediatric neurologist about some of these issues, and when the preparation should be taking place, and what decisions should be being made at what points along the way.
Right. So I would say that as child neurologists, we have often been guilty of insufficient transition planning. Mm-hmm. Often child neurologists feel that the adult epilepsy services may not be able to provide adequate care for their patients, especially the comorbid problems. Adult epileptologists, on the other hand, may feel unfamiliar or overwhelmed by the complexity of pediatric epilepsy syndromes. As I said, the adolescent himself or herself may have insufficient knowledge about their epilepsy, and even the simplest parts of their care have often been attended to by their parents, for example, refilling a prescription. When epilepsy begins early in life, explanations are often directed to the parents, and they may not be repeated as the child grows older, so they may not really have a good understanding of what's going on. So, therefore, preparing for transition is important. It is essential that young people and their family have had a chance to reflect on the changes in care and the importance of empowering the young people to take charge of their own health. Talking about transition should start as early as 10 to 12 years of age. It should be kind of discussed almost every year from that point on. Thinking about a realistic plan for each child is important as they enter adult life. The patient should be able to understand how the disease affects them, what their medications are, how to independently obtain them, what comorbidities are associated with their disease. At around age 12, as I said, early discussions about transition will start. The neurologist should establish an exact age when the transition occurs. Some neurologists should transition at the age of 18, some at the age of 21. So making it more clear to the family would help them be prepared appropriately. It is important to involve the parents and the caregivers as well as the youth in transition planning. Typically, it's recommended at the age 12, when we are talking about transition, the neurologist should review the diagnosis, the details of history, the diagnostic evaluation, results of EEG, MRI, the seizure description, and an understanding of the underlying type of epilepsy. We should encourage the child to to know their medications, the doses, what time to take medications, what is the need for taking anti-seizure medications, and potential side effects. Again, a good time to start instilling some self-management practices, encourage good health practices like getting good sleep, talk about exercise, alcohol, drugs, sexuality, and all those things. For any medical decision making at this point, I think there should be an involvement of the child. The child should be encouraged to voice his or her opinion about the plan, any concerns for medication side effects. The neurologist, along with the parents, would start assessing if the child is ready to be independent. And this information is usually reviewed annually, and any new information or diagnostic tests would be discussed with the child. As the child approaches 18 or during the latter part of adolescence, the child should understand the emergency plan for seizures. It is also recommended that the child spend some time with the neurologist by themselves in the room so that they can discuss any concerns and they can get used to the idea of talking to the neurologist all by themselves. Driving is an important aspect discussed along the process of transition. For an adolescent, a driver's license may be the most important stepping stone to adulthood and a marker of independence. It may be required for employment, for leisure, for transporting family and friends. So every state has their own regulations. Understanding what is required to be able to get a driver's license forms a part of the transition process. And it is also important to discuss career choices and the impact of epilepsy on employment. It is known that the unemployment rate in people with epilepsy is almost twice as high than the general population. And this is more so in individuals with difficult to control epilepsy and those with frequent generalized tonic-clonic seizures. Epilepsy can have an impact on work performance, so that may lead to problems with career advancement and lost potential. So all these changes can affect the care of the young person, and again, having a discussion and understanding of what this all means early on is extremely important. So typically, when the child is ready to be transitioned to an adult neurologist, a transition package should be created, which includes, so as a neurologist, the pediatric neurologist would create a summary of the diagnosis, the workup, the treatments which were tried, the treatments which potentially could be tried in future, and the emergency care plan. And at the same time, the package should have information about non-seizure related problems or comorbidities that the child may be experiencing. And the patient as well as the family should have an opportunity to review this and contribute to this so that they can make changes if necessary. And that way the adult neurologist will have a good understanding of all the issues, and when they assume care of the patient, it will be much easier. In children with intellectual disability, there are some other issues that may need discussion. These may include legal guardianship or power of attorney. Depending on the child's need, the child's ability to make medical decisions for their healthcare need to be assessed. The neurologist may need to review the school placement, IEP results, and need for further educational assessment in some children. And some kids may require assessment for vocational training or community services or other resources for advocacy.
Okay. So is it ever possible to have a medical appointment with the pediatric neurologist and the adult neurologist at the same time, like a co-appointment, so that there can be that more coordinated handoff of care, and they can address the patient's concerns and the family's concerns as that transition is made, or does insurance make that more challenging to have an appointment with both the pediatric and adult neurologist at the same time?
So the model for transition does recommend to have both the pediatric and the adult neurologist at the same time. That is what actually we are also working on to establish a children's hospital where we would have the pediatric epileptologist and an adult epileptologist in the clinic at the same time, to so that the family gets everybody's on the same page in terms of understanding what's going on with the child, what to expect going forward. The adult neurologist has a chance to directly communicate with the pediatric neurologist and the family about the expectations, about the future plan. The family gets comfortable with the adult neurologist, so it's not something completely new when they transition over. So that is the model that would be ideal. Insurance regulations does make it difficult to achieve that model practically. But I believe there are, many centers which are establishing a transition model, having both the adult and pediatric provider at the same time.
Great. Okay, so Jill and Janet, Mitch, and Michelle, can each of you or any of you share some challenges and successes that you've experienced in terms of medical transition planning?
Well, this is Michelle.
Go ahead.
I've had a pretty smooth transition for the most part. I think all the files were sent over as far as the logistics of it. But I've run into the same kind of challenges that the doctor was referring to, is that it would have been really beneficial to my young adult had I had an opportunity to have both doctors in the room at the same time and kind of get to know the family and get to know the patient at the same time. Because, because young adults, well, at least in my position, young adults, they all have different intellectual capabilities, and what they're going to disclose to the adult neurologist is not always completely accurate. So I don't know if they always get the best care. In my case in particular, I just formed a pretty strong alliance with my daughter, and I just, asked right in front of her, hey, do you want to sign a release so that I can ask questions if you don't understand things that are going on? And she has been doing that since probably right when she turned 18. She started signing releases so that I could continue to have that very complex conversation. But doctor is absolutely correct about the young adults with epilepsy don't really realize, in my opinion, that at least my daughter didn't, the effect of their medication and understanding that they have to take it on a continual basis, and they don't want to disclose to their friends, and so they avoid that conversation. So it's a tough one. It's a tough one. But from the medical side, now that we have a good neurologist again, I think he's gotten to know my daughter really well. But it's taken a good 2 years, I would say, for him to really start to understand her personality and to be asking questions like, how accurate is some of the information that he's receiving?
Right.
That's just my experience.
Right. Yeah, and I think that's a really important point about there are ways for parents to be involved even after their child is made that transition, particularly if the child has any kind of intellectual disability. So any others want to share their experiences with medical transition?
Well, this is Jill. I don't necessarily have to share, like my son just turned 18 last July, and as I said, he has significant neurodevelopmental disabilities, so both his pediatrician and neurologist said they would continue to treat him for a while, and I think it's because of that, because there's so much going on and all of the developmental and behavioral issues. So it's obviously a concern for me looking forward to, considering that transition, obviously, at some point. I feel fortunate that they've kept him on, but that's a concern for me going forward.
Mm-hmm. Yeah, Dr. Agarwal, does that, I imagine that varies from institution to institution and from neurologist to neurologist in terms of how long past the age of 18 or past the age of 21 even that a pediatric epileptologist will see a patient. Is that pretty much dependent on the neurologist or the institution?
And the patient too. I know there are patients that I see who turn 18 and they don't want to come to a children's hospital. So yes, there are a lot of factors which would dictate when the transition actually occurs. Right from the comfort level of the parents to the comorbidities in the child, as Jill was saying, kids who may have other neurological problems in addition to epilepsy may probably stay on with the pediatric neurologist for a little bit longer compared to teenagers who have epilepsy but no other neurological problems. So yes, every child is different, and not one size fits all. So we have to see how comfortable the team feels with the transition at one point.
Sure. Yeah.
When I asked my daughter about this transition, in preparing for tonight's conversation as well, she was saying the difference was that her pediatric was, always available. Like he'd call us on the phone if there was an issue or whatever. But she said now that her appointments are much more scheduled. That's what she calls it. Much, more scheduled, less personal, more sophisticated conversation, and sometimes doesn't always understand some of the language that's used. And so I think that's the big shift very quickly. It's the sophistication of the conversation, assuming that now they're 18 or 20 years old, so that means they're an adult, and they're not always there intellectually.
Right.
Hey, Russ, what we did for our daughter, so she's 21, almost 22. I would say we're still transitioning her, right? And each children have their own personality, strengths, et cetera, et cetera. Probably in the last year and a half or so, and she has always wanted us to come in with her on her appointments. So that's been great, right, for helping her as well as to kind of keep our minds at rest. A couple of practical things, right, to do is when you meet with your new epileptologist or wherever you go, get any and every release that you can get signed so the information can be released to parents, because they will start to shut you down legally. They can't share, et cetera, et cetera. So that's a very practical administrative thing. But what we have tried to do with our daughter is, it can be intimidating as a young adult to talk to adults, and especially a doctor, no offense for anyone. But now she really runs the meeting with the doctor, right? She describes how she's feeling. And what we do is maybe try to catch things that didn't quite happen this way, or this is, this is what you told us. And the other practical thing that I think I would offer up is, most kids have phones today. Our daughter keeps a list of her meds on her phone, just so in case she ever does forget or we're not there, she can reference something that clearly lists, what medication she's on.
Yeah, great points. Certainly, smartphones can be a tremendous tool in taking on more responsibility for self-management. So, okay, great. Well, transition planning should also take place in the school setting, either as a formal process associated with the student's IEP or as an informal process where the student's post-secondary goals are discussed. So let's start by talking about the transition planning that schools are legally required to provide as part of a student's IEP. Jill, can you address this and provide some examples of the types of transition services that can help students with epilepsy move towards their post-school goals?
Yeah, I'd be happy to. So the transition component of the IEP starts taking place in the IEP that would occur before they turn 16. So that IEP just before they turn 16, they legally have to start incorporating the transition component that I'm going to talk about in a moment. But that doesn't mean you have to wait until they're turning 16. In fact, I think, as you're going into high school and as an 8th grader, any child, whether they have epilepsy, an IEP, no IEP, you're starting to think about transition, they're going to high school. What are they going to be doing after high school? So it's something that you can ask for earlier if that would be helpful in your situation. So what it entails in the IEP is that you have to make post-secondary goals, meaning what does the child want to do after high school? Or if they're not going to graduate from high school, for those kids with more significant delays, we're going to talk in a moment, they can continue to get services. What are they going to do after that, school component ends? And making those goals. And like I said, that is something that any student is doing, considering. So when we ask those questions, the goals, we look at what kind of job do they want to have? Do they want to, go to college, or do they want to go to a vocational school? And you can also consider independent living skills, and I'm going to talk about some examples in a second. But one thing that's important as part of this is when they ask these questions, they may flat out just say, what would you like to do after school? But they also do transition assessments that really explore the student's strengths, interests, and preferences. And that's a really important component because a lot of the IEP, when you're going through K through 8 or those earlier years, you're only just talking about what are the child's needs. They're having, struggling with reading or they're struggling with organization, and then you're trying to address those needs. But now we start taking into what does the child want to do? Where do they want to go after high school? So they make the goals, and that's that long-term goal that you would have for post-high school. And the transition services are, what can we do now to help you move towards those goals? So this is obviously going to change from year to year because as you enter high school, you might say I want to go to become a doctor, but as you go through high school, you're realizing these, chemistry classes and, biology classes are really difficult, so it can change. But asking, what do you want to do after high school? How can we assist you in moving towards that goal? So an example, so let's just say going towards, a student who really does want to go to college after high school, attend a four-year college. They kind of know maybe their interest levels. So one of the things transition services could be the students doing is, what any student would do is, looking at what kind of college do they want to go to and maybe identifying which ones they'd want to apply to, working on filling out the application. And once they fill it out, do they need someone to check for errors? So that's something all students are doing, but now we can start incorporating that into the IEP if they need assistance with that. One thing I do want to say with transition services is when you talk about, like, let's say in this case, the student needs to obtain an application and fill it out. That service, you talk about it, is the school going to help you with it? Is the parent or the student? So it might vary. So some of the components the school will address, and that's what you talk about in the IEP. Same thing if it was employment. If you, like a student wanted to work with cars, let's say they say, as going to high school, I want to work with cars. Well, as they go through high school, they're starting to understand, what do I need to do that? I may have to enroll into a technical school to learn those things. Or maybe in the high school, like I know one of our state speakers, her son had an interest, he has autism, looked at the classes within the high school, but geared them towards what could he do in that auto class that he was capable of. And he took the class all 4 years, but they geared what was he doing in there towards his post goal, towards working with cars. So it's helping you transition, to those goals, but what do you need help with now? And that doesn't, my son has more of a developmental delay, so I gave examples more for a student who's maybe going to college and job. My son has a lot more challenges, so it could be something as simple like, let's say you have a student, they say, I want to work with pets. Well, maybe during high school, we need to explore what that looks like. We go visit, a pet shop. We go visit a veterinary school, exploring that. Or maybe they work on just being able to task completion. So it can be as simple or as complex depending on what your goal is. So it's the simple way, like I said, is to say, what is my goal after high school? What do I need to do each year in high school to work towards that goal? And how can school or my parents or what things can I do to get there? I do want to mention one other area, too, because it's not just like education or vocational school and employment. We can also look at independent living skills. So I think that's an important area to consider, especially for individuals with epilepsy. If they aren't able to drive, like for instance, you could be looking at a goal of being able to navigate public transportation independently to be able to maybe to get to the college from their apartment. It can be things as students are getting older and they're out of high school and working on, bank accounts or grocery shopping. There's a lot of those areas. So there's a big range in what it looks like depending on where the child's skill level is.
Great. Now, do you find that, at least from my perspective and having talked with some parents, that it varies from school to school and school district to school district in terms of how intensive these services are and how aware parents are made of the availability of these services? Because I've certainly run across parents who didn't even realize that transition planning services were even a thing, or that they were part of the IEP, or that they were even available.
Yeah, I definitely think that it's not a well understood component of IEP and maybe not utilized well in terms of helping that child transition through the high school, and what are those ancillary components that we need to work on to help them in their post-high school life. And that's why, as Michigan Alliance for Families, as a mentor, like someone calls me, I can send them written material, sit down with them, explain this process, look at their IEP, talk individually, and same with the mentors that we have throughout the state. We have webinars about this as well. So that's go to our website, Michigan Alliance for Families, where we talk about the transition IEP and the legal components and what it looks like. So I think it's something that we work on in terms of educating families, because I do think that it's not utilized. Like I said, like our state speaker, had she not been really advocating for, like, I want my son to take the shop class, and I want, right now he's going to learn maybe just to use this simple tool. And then he worked, you know, not thinking that he could get to some of the more dangerous tools, but he did. And he's an adult now, and he works at a car dealership. You know what I mean? But so it takes a lot of involvement in the parent, but also that understanding. So that's where our role in at Michigan Alliance for Families is to help you understand that component and navigate it.
Okay, great. So many students and families are faced with the decision of whether to pursue a diploma or a certificate. Can you explain the impact of this decision and that the impact that it has on students, the students' ability to receive continued services through the school system, and then also the impact on future options beyond school?
Yeah, so when you receive a diploma, that's one way you graduate out of special education. If you receive a diploma from high school, then you no longer can receive special education services or an IEP. That ends at your graduation date. But that doesn't mean that you can't still have accommodations as you go to public colleges or in the workplace, and that's usually through a 504 plan. So an IEP is broader than a 504. It has accommodations, but it has services that maybe work on a skill like reading or organization or behavior. So a 504 is those things, those accommodations are like maybe you need extra time on tests, you have slower processing speed because of your seizure meds. You need to take your tests in a quiet place. You need the teacher notes because it's hard for you to keep up with those. So those are things that you can still have as you go post-high school, even though you don't have the IEP, but you have to self-advocate. You know, when you're in school, they're just asking and we're working on this, but you have to go to the disability service office at the college and let them know and self-advocate, same in your job, that this is what I need, this is my disability. And when you graduate from high school, they do something called a summary of performance that would talk about, you know, what are the things that you had in high school that help you be successful, that can help you as you go into that college to demonstrate, like, this is something that I needed and helped me be successful. If you don't receive a diploma, then you get what's called a certificate of completion. And that doesn't mean anything legally at all. It just basically means you attended high school. You went to classes, but you haven't met the curriculum standards necessarily for the Michigan Department of Education to earn a diploma. If this occurs, then that means you can continue to get services through the school district through the age of 26. So usually people call these post-secondary programs. So that means you're going to go to a center that's going to work with you on the same things that maybe these students who have a higher functioning are working on in high school, working on those skills towards adulthood, working on employment skills, working on continuing education that you may need, working on those independent living skills, like I said, maybe banking and money management, or maybe even, you know, your meds and being able to schedule appointments and those things, those life skills. So you can continue to work on those, all those things. You continue to have that transition component to the IEP every year, asking what you want to do and what do we need to do to get there. You can still, if you graduate with a certificate like college, like Oakland Community College, you can still attend if you didn't get a diploma. So there are options where some students may be going to the post-secondary program at the high school to do some learning or independent living skills, but then maybe taking some classes at the community college that might be in their interest area. I think there was a second part to the question that I want to make sure I answered everything. So, that obviously the impact is just looking at where you want to go. So, but it doesn't mean that you can't still work towards even the high school diploma or a GED if that's something you're capable of. So I think it's just like an IEP, it's individualized where the student is and where they can go, and helping them figure out what would be best. But if you have the skills to work towards a diploma, then obviously that's where the school is going to try to support you to do. I'm not going to go into a personal curriculum, but it's something that we have on our website or you can call us about. I'll just mention briefly that sometimes you're a student and you can handle most of the curriculum, but let's just say I can't get through Algebra 2. That's just going to be too much for me. There is something that can be considered. It's not really waiving it. It's saying that the superintendent can say, okay, this student doesn't have the skills to complete Algebra 2, but they're going to take this other functional math class, and I will accept that as the curriculum standard for graduation. So there's other ways that maybe there's a couple areas and there's certain guidelines what can be considered in a personal curriculum, but it's just something to know about because maybe your student does have most of the skills to graduate, but there's just a couple areas that are, especially that, like that Algebra 2, I know I hear is a tough one for a lot of students with learning challenges. So.
Okay, and just to confirm, so like for instance, if someone decided to go the certificate route and was receiving services up until age 24 or 25 and then decided, you know what, I think I can do a diploma, they could still get their diploma, right?
Well, I don't see why at any point anyone to get their GED, you know what I mean, if they can pass that. So, you know what I mean, there would be nothing to preclude someone to say that, to get that.
Okay. And for students without an IEP, just briefly, what types of assistance may be available in the school to help with planning for life after school?
So I think one thing, I have an older daughter who doesn't have epilepsy, or I didn't have an IEP, but it's helped me navigate this. And there is a lot of support, and it's using those supports that are there. There's a school counselor that you want to definitely take advantage of to help you. Just like I said with a student with the IEP, we talked about trying to figure out what college and getting the application and what do you need to get there. That's what the school counselor can help with. And that, we did with my daughter who didn't have an IEP or epilepsy. There's, the college representative that's bringing in schools. So there's a lot of assistance, I'd say starting with the counselor, because then they can kind of say, okay, this is maybe what you need, and give you other resources if you need something more outside of like maybe what she provides, because I know there's like different individuals who can help you navigate even doing the college application. Sometimes that's like a paid service, but I'd say taking advantage of the school counselor. I met many times with my daughter's school counselor to talk about what was needed in the college that she wanted to get to and what did her profile look like, and helping her narrow things down and just a lot of those things. So take advantage of those resources that are free and that can help you navigate the system.
Okay, great. And for our parents, can any of you jump in with any key lessons learned from your experiences with transition planning in the school setting?
Well, Jill, you did a great job of explaining all the options that there are out there for students, and I was lucky enough to have my daughter in a district that did have a transition coordinator, so she was able to really kind of help us navigate some of these opportunities. My daughter did receive a diploma. She did utilize a personal curriculum specifically for what you had described, for that Algebra 2 component that was really difficult. And one of the ways that we found success for her was through the Career Center. Many of the Career Centers have programs that will kind of embed those mastery level math skills needed for, like, for instance, graphic arts. They could embed those in the curriculum so that there was the math component, and she was able to use the personal curriculum instead of having to take Algebra 2. So that was really phenomenal. Another thing that our transition coordinator suggested was MCTI, which is the Michigan Career Technical Institute, I think, and I don't know if they're still running, but they were in Plainwell, Michigan, and it was a week-long experience where your students with IEPs can go during the summer, and they have a full assessment of what their skill levels are. I did that for my daughter, I think too early. I think I should have waited until her senior year to do the week-long experience, because they really expect the students to be able to demonstrate those independent life skills you were discussing. You know, they have to be able to manage their medication, get up on their own with their own alarm clock, you know, get to class on time. So it very much simulated a college dorm experience and a college experience. So, but it was a great assessment. It kind of gave us some tools when she finished that week-long assessment, you know, like, would culinary be a good option for her? Or, you know, is auto the best thing, you know, for other students? So there was a lot of things going on that. So if that's still available, I think for other parents that might be something to look into. But the downfall that I found or the lesson I learned was that I really pushed for a diploma for my daughter, because I thought that she could handle that. And as a result, when it came to the end of her career tech program, which was a 2-year program, she only did the first year in her senior year. So to go back, she would have gone back as an adult. And at that point, there was no more funding for her to go back as an adult, and they wouldn't allow us to pay tuition. So I kind of sold myself short and her short on that. Had I realized that I should have just given her a certificate, I probably could have got her in the second year and continued on with that 2-year program. So we only got 1 year of it. But, you know, she did go on to a community college and took another class afterwards. So, but that was my big goof, I think, is that if they're not really looking at the big picture, like you said, look at the transition. Like if they are going to use a 2-year program at a tech center, you know, is it better to postpone that diploma until you can finish that vocational training so that you can continue as a high school student? Just a thought. Anyway, that was my experience.
That's a good point, yeah.
Yeah, and I apologize, I didn't mention when you have an IEP, there's a transition coordinator. So they are to help with that process, the IEP team. They're not necessarily, and it's good to know that, because they don't automatically just start showing up at the high school transition. Like when my son is transitioning to post-secondary now, she's at the meeting, but that's what their role is, to talk about what are options out there, you know, if you have an IEP, and help you navigate that. And that's not, people don't always know that that's an individual in the district. And there are other, you know, what you mentioned, the kind of like trial, like I know Michigan State is having something where it's kind of like, you know, where you go for a weekend or it's like 3 or 4 days to like kind of as a trial for those students who are going who may have challenges or disability. So there's different, and that's something that like you could ask the transition coordinator about that information to help you. Is there something going on this year? But I know I got something, Michigan State's doing one June 24th to the 27th, you know, on that. And something that, like I said, sometimes we don't know every single thing going on in the state, but that's what our role is, not only to help you understand the process, but if there's information you need, like who can we direct you to as a resource to help you get more information on something. So,
okay.
Awesome.
Mitch and Janet, anything you wanted to share in terms of lessons learned in the school setting?
You know, Russ, just from the school setting for us, we did an IEP, and we also, you know, had what we called a rescue plan for Laura. And, you know, we would go to the school, high school. We would go to high school the beginning of every fall, right? And I found that when you did that, when you were proactive, you came in and say, here's what Laura has, here's our rescue plan, here's who to call, here's what she takes. You know, our school bent over backward to support her. So for those parents who have not engaged with you, do a formal IEP or whatever, but when we proactively reached out to the schools, they were nothing but supportive. I mean, I can't give them enough kudos for the type of support that they gave. And Laura really went through at a normal pace. She had a couple of exceptions, but just went through at a normal pace. We did the same thing when she went to college. You know, we went to the the disability office. We did that for 2 reasons. One, just to make the school, you know, aware, and two, and I don't know if everyone knows this, your child, your student, can actually get more time on courses, you know, on tests, I should say, if you get that disability form approved. And our daughter would present that to each professor, explain her situation, give her the form from the disability office, and that, you know, that served her pretty well. So those are really only the 2 points I think that, you know, that we would bring out from a school transition perspective.
Great, thanks. So let's shift to talking about epilepsy self-management, because obviously part of becoming an adult with epilepsy is learning to fully manage your condition, and that includes things like sleep and medication adherence and tracking your seizures and side effects, communicating with the healthcare team, things like that. So can all of our panelists kind of jump in with any thoughts on how you can effectively shift self-management responsibilities from the parents to the teen, and do so in a manner that doesn't expose the child to undue risks, but does help gradually move them towards more independence.
So Russ, I'll jump in on what, and I would said for our daughter, right? So again, she's 21, senior in college. I think we're still in that transition phase, and to give a couple examples for that, right? So we have a very good relationship, with our daughter. We've always said to her, hey, there's nothing you can't talk to us about, and to her credit, right? To her credit, she's been very open with us, so that has been nice. But what we have tried to do, again, I think we talked about this at the beginning of the call. She invites us to go to all of her meetings with her epileptologist. But we are assuming a more and more silent role, right? We may talk about it with her when she goes in, so, hey, what do you want to talk about? And if she's had a specific episode, we'll say, well, remember this, remember that, you want to talk about this, med, or whatever it is. But she's now really leading those discussions with her doctor, with her physician, and we just try to support her if there's something that we recall that she did, she doesn't. And what we found is, in our case, I think young adults are a little intimidated to talk to. She knows her doctor fairly well now, but clearly not the same as when she was in peds. They're a little intimidated to talk to a physician, right, on serious stuff. But we're letting her now really lead that conversation. Most of the time, we're quiet. She clearly knows all of her meds when she takes them. Again, she has them on her smartphone, right? She has a list of what she takes when. We used to almost call daily, hey, did you take your med? We're now not doing that, and that's hard as a parent to let go, because you want to always, safety is always first. But, as a young adult, that's really up to her to make sure she takes them. And we have confidence that she is, and we haven't had any episodes that she has not. We maintain, though, we still maintain a log of all of her seizures, and, we put it into a spreadsheet. Maybe that's the geek in us coming out, but we continue to put it into a spreadsheet, so if we have to ever, share some specifics with her doctor, we can do that. But I think the biggest thing is, and each parent-child relationship is different, is, we're now at that point of, we've let her, again, run her appointments with her doctors, and I think this is just so important for our daughter is, to always make sure, though, that support system is there. We're here no matter when, rain, shine, you call us, and we come running. I think that level of support in our situation for our daughter is still very important.
Great. Other thoughts? Yeah, go ahead.
I do have a couple thoughts, because I think it's phenomenal that how you just mentioned that it's in transition, because I think that is truly what happens for all of us as parents of young adults. You never stop. I have seen my daughter go through some transition where sometimes she's really good at taking her meds all the time and right on top of it and wants help, and there's other times where we have a week where you could just see she's off the radar, like not remembering to take them, and then that's like when you have to gently remind or say, it has been a couple of days. That's why I say, you haven't missed your meds for a couple of days, have you, or something like that, because she knows, unfortunately, has learned the hard way that if she doesn't take her meds after about 2 days, she will indeed have a seizure. And sometimes she hasn't told some of her new friends at college that she has a seizure disorder, epilepsy, or her friend group when she meets new ones. And unfortunately, those have become lessons, very ugly lessons. Like one individual actually called an ambulance when she had a seizure. He didn't know what was going on with her. And then she came to and was able to describe it to them. So now that friend helps her with her meds and reminds her, another one that happened another time where she hadn't told another friend and they were going to, do mouth-to-mouth resuscitation, didn't know what was going on. So I think that it is all transition, and unfortunately with some young adults, they kind of go the wrong way and they learn the hard way. And so now she's pretty good about it. But we do have to do gentle reminders, that's for sure.
Right. And
so,
go ahead.
Oh, sorry. Go ahead, Russ.
No, I was just going to say that, certainly with epilepsy in particular, as far as chronic diseases go, that risk of having a seizure can be a very strong motivator to take your medications, and in those who are seizure-free for a while and have a driver's license, that's obviously another key motivating factor that can be very helpful in reminding people to take their meds. So, go ahead, Jill.
I was just going to say, so yeah, my son, we haven't really shifted the self-management just because of he just turned 18 and the level is delayed, but I do have, as I mentioned, a 21-year-old. So I know, and she has a medication and just to shift, and she has a reminder, the kids now are using so much their phone, and she has a reminder, it goes off every night at 7 o'clock to take her medication. I think using some of the apps, I don't use it, but I know there's, the seizure tracker app. I know I learned about at the epilepsy conference a couple of years ago, the seizure alert watch, but now I was just actually Googled yesterday because I was curious, and my brother told me that he thought that the Apple Watch was going to have that, and what I pulled up online was that there's an app for the Apple Watch. It's a seizure alert app. So I know that the watch, I don't have this, but a couple of years ago when I learned at the epilepsy conference, that you could get a text or this, if they're wearing it, then you get that call to let, or someone can be. So just, there's a lot of different ways and I think tools that can be helpful for students, especially since they're using their phones a lot to track things. And I thought, what the Weisz's said about having the meds on the phone, like I've sent my daughter, like I said, who doesn't even have a disability, like our medical history. So she has that all written down. She doesn't know it by heart. This is something that any individual is transitioning to manage this and getting their scripts. And so making it easier and having it written and things on their phone where it's easier for them to access, I think, is something just to consider.
Right.
One thing I want to just add in, this is Janet, Laura's mom, is something everybody probably knows, but we didn't really think about it, is as they go off to maybe college or somewhere away, especially then to try to get an extended release on all the medications so they're not taking them twice a day if they don't have to, so there's less risk of forgetting, and then also to talk to them about storage. When they're here at home or at school, everything's under lock and key and it's in a cool environment, and when they're at school, it could be in a backpack in somebody's car, and just to make sure how much are they going to have of the medications, and are you going to keep, a supply at home kind of as a backup. Just a few little tips that we, over the years have learned when we've been in situations like, oh, we don't have a med here right now, or do you mean you left that in somebody's hot car for a night or something like that.
And Russ, one other real practical thing is for when kids go away to school, is to, and they'll be very resistant to do this, but to get a couple phone numbers of their friends. So, just in case something ever happened and you need to get in contact with someone, the parents have a way to contact someone who is there. Again, I think you'll find most kids are reluctant to, give their friend's phone number, but we've asked and we've got a couple of them. So
that's a really good suggestion. Yeah. Dr. Agarwal, did you have anything to add in terms of suggestions regarding, again, gradually transitioning that responsibility for self-management?
No, I completely agree with all the thoughts, I think using the devices, using the apps is a very good idea. Most teenagers would have a phone, right when they are 13. So I think incorporating the reminders for medications, the seizure diary on the phone would be very, very helpful. I think as they move along the road, apart from taking medications, I think they should also, be able to maybe schedule appointments, have reminders for their appointments, write down questions that they want to ask, encourage them to ask questions during the clinic visits, maybe leaving them alone in the clinic, for some time with the provider, so that way, they have a 1:1 time. They get used to that process overall.
Right, great. And just as a little shameless plug here, our next Learn and Share conference call is actually a webinar, and it's on smartphone apps and online tools for managing epilepsy. So that will be a great review of all of those different technologies that can really help with that transition to in terms of self-management. So, all right. So the goals of teens that teens with epilepsy and their parents have for life after school depend in large part on the severity of the teen's epilepsy and the presence or absence of other neurodevelopmental disabilities. So let's look at 3 different points on the spectrum of epilepsy. First, a young adult attending a 4-year college, a young adult with some moderate neurodevelopmental disabilities who's maybe seeking vocational training, employment, or semi-independent living, maybe taking some classes, that type of thing. And then a young adult who has severe epilepsy and more profound intellectual disabilities, whose employment and independent living prospects are much more limited. So, Mitch and Janet, can you talk about your daughter's decision to pursue college and the kind of the steps that you took to prepare and some of the challenges she's experienced so far and what resources and strategies have helped along the way? And I know you've already referenced a lot of this, so just maybe anything that you haven't already discussed.
Sure. So our daughter has just to kind of set the stage real quick for everyone. Our daughter has simple partial seizures, really limited to her just to an arm. And when she was in high school, they were very short, as in seconds, and very infrequent. So as she was going through high school and junior, senior year, when college started to pop up and you get to fill out all those lovely applications that I'm glad I don't have to do again, the transitioning to college didn't seem real difficult for her, again, because although her epilepsy wasn't controlled, her simple partial seizures were few, short, and far between. We certainly, always speak very honestly and candidly with her. Hey, look, that sleep and stress, which can't be avoided in college, are very 2 typical triggers. So, you have to, we want you to have fun, experience college, but health and safety always comes first. Unfortunately, for her and for us, her simple partials have really increased in the last year to the point to where she has actually had to withdraw from college now twice, and took some classes online from a local community college just to keep the degree process and work. So, our path has gone downhill, if you will, in that her simple partials are now, virtually every day, minutes long, and she is frequently taking medication so they don't progress. So she wants to go on. We would prefer to go on to graduate school. Also with, can she, actually do that type of curriculum, given that, her simple partial seizures have increased. And I think, as some of you unfortunately probably know as well, when you take a rescue med, that tends to kind of knock you out mentally. So to be candid with this group, we're kind of in a second transition, and that is she should graduate at the end of August. That would be nice to get the 4-year degree out of the way. But from the parents' perspective, it is unclear, what she will be able to do next. I will say this, so I will offer this up. And again, and we all know this, right? Communication with your child is so key. And for them to know that we support them is, I guess I can't stress that enough, even for the adults. And she has mentioned how much she appreciates that support. The reason I mention that here is, as we kind of nudge her along and have said to her, hey, this might be hard, she has reset her expectations too a little bit and said, geez, I think I may need that support. If I go, I probably will need to look at schools closer because I like mom and dad's support. So again, just that simple, routine, consistent communication, I just can't say enough about it. But I'll stop there, Russ, if anybody has any questions.
Okay, great. Michelle, can you talk about your daughter's journey so far, her goals, challenges you've both experienced so far, and what resources and strategies have helped you?
Well, in my case, I would say my daughter is probably at that middle road where there are some developmental disabilities. She refers that the world just moves too fast sometimes. She processes at her own pace. And so work has been difficult. She's had a little job, but maybe 2 hours throughout the day would be the maximum, and then got to go. Has dipped her toe in the community college arena and taken a class that she thought would just be fun, and did utilize accommodations with the 504. It's a great resource, and I think that it was a really positive one, but again, it only works as well as the young student will execute or evoke the 504. So if you don't want to say, in her case, she didn't always want to tell that she needed extra help. So I think that wasn't as successful as it could have been. So I think if she goes back in the fall, I'll probably ask her if I can go along again and try to advocate and nudge along with her educational goals. She is living with us currently, and she would love to move out and be more semi-independent. Her big goal right now is to get a driver's license. And so that's, as you were saying earlier, is a huge motivator for her to remain seizure-free and take her medication daily. So I would say that slow and steady has been our life. She's always been a little bit behind developmentally, so I'm seeing some behaviors now at 20 that I would probably say are more like a 16-year-old, and that's okay with us. We know who we're dealing with now, and she is starting to make her own plans and actually verbalizing her own plans. So I think we're moving in the right direction, just slow and steady. I have utilized the services of the schools. I've utilized the services of community college. I've utilized the services of ARC, which is a great little resource. They do seminars like after you're gone, you talk about independent living, and so I've told her about some of those resources out there, and we're kind of working through them a little bit right now too, which has been nice. And the last thing that we've been doing right now is working, and it's something we haven't mentioned in this conversation, but I think that for many of our young people that are working, dealing with chronic illness, the social emotional component is difficult for them. They do feel depressed at times. They do feel anxious. And she's been able to tell me more about that. So now we've really solicited the input and the support of a really good social worker, and that's really helped a great deal with some maturity. So that's where we're at in our family.
Great. And did you decide to apply for SSI or Social Security disability benefits?
Yes. We just did work with disability and have made that application. It's a long process. It's taken us probably a year and a half still that we've been involved with disability, and we're just kind of coming to the end where they're making judgment. And I think that that's been positive. I haven't looked into what more we can do with it at this moment. We're just kind of moving through that process. So
sure. Okay. And lastly, Jill and Dr. Agarwal, the third scenario we listed is perhaps the most complicated, and fully diving into it could be a whole separate Learn and Share conference call. But having said that, can you briefly discuss some of the key things that parents need to consider as their teen approaches adulthood, and resources that can help to maximize the young adult's quality of life and self-determination if they have a significant developmental or intellectual disability.
Yeah, I can start with that only because it's very fresh for me. As I said, my son just turned 18 last July, and so I not only have done it for him, but this is something that we do education on for my job. So one thing that was just mentioned is the ARC is a great resource to help with navigating this transition to adulthood and Social Security or guardianship and all of those things, and also Michigan Alliance for Families. I'm just going to say our phone number so that you'll have that. You can look up the ARC, or you can, when you call us, we're very connected to the ARC. So I know when parents call me, I give them information, then I connect them to the ARC in Oakland County. We work very collaboratively with them. So if you need help in navigating or looking, or who do I call in my area, Michigan Alliance for Families, it will geo-route you to someone in your area, and our number is 1-800-552-4821, or you can Google Michigan Alliance for Families. But I'd say starting, one of the things that you don't have to wait until they're 18 is consider the financial planning. When you are an individual applying for Social Security, you can't have more than $2,000 in assets. So when your student, is approaching that age, and maybe you don't have any assets, but you can still put in a special needs trust in place. We did it probably 9 years ago, and we don't have any money in the trust, but it's there. If something happened to us, then our assets wouldn't go right to my son, and then as someone who qualifies for Social Security, that would affect his eligibility. It would go into the trust if something happened to us, and that wouldn't be counted towards his assets. And so a lawyer and the ARC can help you. They have lawyers who can help you draw this up, but it's important to start considering that and not waiting to have that in place so that, those assets don't affect any of their qualifying for supports. The other thing I think that as they turn 18 is looking at what legal control you may have to have, and there's a lot of considerations. There's guardianship, and there's full and partial, and there's a lot of alternatives, power of attorney, just taking control over maybe their medical or their financial or whatever pieces they need help with. So there's a lot of considerations with that, and we do a workshop usually like every year in Oakland County, and our different mentors throughout the state, we bring in and have a whole workshop just on considering guardianship and alternatives, because it's something really important to understand. I think Michigan, something is very much a guardianship state when you have a child with a significant disability, and school will tell you, and you'll go to Social Security, and they're going to tell you you need to get guardianship. And that's not always the best. You have to understand the choice you're making, and like you said, this would be a whole workshop in itself. But we have information, call the mentors, call the ARC to understand that decision making, because there is other choices. And even when you go to Social Security, when I went with my son, I haven't decided to take guardianship, even though he has a significant, for some personal reasons and things, but they said you need to get guardianship, and that's not the case. He's able to sign his name and say, I want my mom to help me. I want my mom to talk for me at this meeting, and that's okay. And they also have paperwork at the Social Security office called appointment of representative. They won't accept power of attorney, but they have their own internal paperwork called appointment of representative for you to be able to speak for them, but they don't. Like, no one told me that when I went to the office. So it's just a lot of things that sometimes isn't just forthright given to you to look and connect with someone who's familiar with the process. But once they turn 18, if they have a significant disability and you make sure that they don't have more than $2,000 in assets, you can apply for Social Security as someone independent. Even if they're living in your house, that doesn't matter. They're an independent individual once they turn 18 and may qualify. So my son has qualified for Social Security, and once you do that, then it opens up, depending on their disability, a lot of other avenues. So through your community mental health system, then once you get Social Security and you get Medicaid, then you can go to get support to help them live that more independent life that Russ was talking about. So, like, for instance, my son qualifies for a certain number of hours a week to help him work on living a full life, being out in his community, working on more independent living skills. And we also get some respite, which is very helpful when you have a child, who needs 24/7 care. So that opens up helping them work towards, whatever supports they need to live a full life, whether then there's also supports through, once you qualify for Social Security, again, you have to do that first through Michigan Department of Health and Human Services, and it's called home help. So, for instance, my son does need help eating. He does need help preparing his meals. He doesn't manage his medication. So we can apply for that, and based on a formula on how much help he needs, if it's physical help, then we get funding because we're doing that job now. So we get money for taking care of those things. So it's very helpful because a lot of comes out of a pocket when you have a child who has a lot of needs. For, individuals who maybe aren't as impaired as my son, there's Michigan Rehab Services, too, to help you navigate, jobs and supports, and that whole venue is another agency. Housing, there's agencies, and that's why I say connect with the ARC or the mentor for Michigan Alliance in your family, in your area, because like in Oakland County, we have community housing networks that can help you work on living arrangements, or some of the different agencies, and there's different organizations, and so it's not always the same across the state. What organization necessarily helps with those things, but the Community Mental Health and the Michigan Department of Health and Human Services and the ARC are all pretty set throughout the state that can kind of help you navigate that. But there's a lot of pieces, and so it is a full, I could take all night to go through all of this in detail, but there's individuals there to help you navigate it through that process if you have more specific questions.
Great. Well, just looking at the time, I think we should open it up for questions. Okay, who'd like to get us started with a question?
Okay, I will.
Okay.
My name is Nina, and my daughter is just turned 13. She's had epilepsy since age 5. So around this age of 12 or 13, you're saying that the transition should start at this time?
Yeah, this is Dr. Agarwal. Yes, the discussion for transition, I think, should start at this age. There are many different reasons for epilepsy in children, and if it seems that the kind of epilepsy that she has, she would perhaps continue to need care from an adult neurologist after she turns 18. I think this is the time when the conversations should start. So then, the principles of self-management, the issues that come up with transition of care, these can, well be discussed ahead of time.
Okay, thank you.
Other questions?
No, I'm sorry. This is Grant, and I was just gonna ask the doctor why 12 to 13. It sounds like a very young age, and why really that is the time for transition.
Yeah, and again, just to clarify, I think that's just the time to start talking about transition. It's not, you don't have to have everything figured out by 12 or 13. It's more just that's a good starting point to just because it is a process. But Dr. Agarwal, did you want to talk about why so early?
Yeah, no, I agree. Thanks for clarifying that. So that is really the time where most studies have shown that if discussions are started at that age, the transition is much more smoother. These models of transition are developed looking at kids with chronic medical conditions, not only epilepsy, and be it diabetes, be it rheumatological conditions or other neurological conditions. It has been shown that as teenagers, they want to be more independent. They are learning about the disease, about how the disease affects them, or about taking medications regularly. There is things, the changes that occur with adolescents. I think it has been shown that if the discussions about independence, about self-management are started at this age, there is more success in achieving a good transition eventually to adult care. So as I said, the goal is not to transition when they are 12. The goal is really to initiate a discussion with the understanding that the child will eventually be taking over, the care of the disease by himself or herself.
But just beginning it, basically, and starting to bring it up, kind of.
Right.
And
right. So more of education, and again, making the child aware about the need for taking medications, instilling the traits where they can start reminding themselves about taking medications, because it's not going to happen overnight. So started early, there are more chances to be able to achieve a successful transition.
Okay, great. Well, that's very intelligent. Thank you very much.
All right, so other questions?
Hi, this is Ron. I joined a little bit late. I have a 13-year-old son. He is severe. He's got Dravet, and we are wondering when and how do we start the process for looking at long-term living arrangements for him.
Well, I can speak a little bit. I mean, I think part of navigating that is as when he turns 18, is part of these agencies that provide some of the support. But you certainly could connect with your ARC and your mentor from Michigan Alliance, in your area to start talking about, is there different agencies who support that so that you can start, understanding some of that process. Like I know we have Community Housing Network, and they have like getting your own address and, how to navigate, maybe looking at getting their own address for this child, but maybe living with other individuals, because when you qualify for some of the supports that you get through the community agencies, if you live with other people, then you can group those supports. And so let's say he gets 20 hours and there's 2 other people. Well, then that's 60 hours a week that can be shared through so there's a lot to that process. So I would say connect with your ARC to get any information on that, and like how in your community, is there group homes? Is there, this process, getting your own address, is kind of working more on your own. But there's like in here, we also have a place called Angel's Place that's like a Christian-based place that helps individuals find placement maybe with a couple other individuals. So it's kind of different in each community. So I would say connect with your ARC and Michigan Alliance for Family Mentor to try to find some of that information just to start, because sometimes there is waiting lists even, if it's, depending on the process. So I never think it's too early to at least get the information so you know what lays ahead.
Right, and now I can also refer you to, on our website, under Learn and Share conference calls, we did one a few years back on residential options for adults with epilepsy, and that would be a good one to listen to. We actually had a presenter from Community Housing Network, which I know is on the southeast Michigan, and you're in West Michigan, but the presenter talked a lot about different residential options, so that would be worth a listen.
All right, thank you.
Okay. Maybe time for one more question.
Hello, my name's Jackie. My daughter is going to be going to a 4-year college, and she has a 504 plan. Will that help at all for her college years?
Yeah, so that's what I talked about. You can have the 504 plan and those accommodations, but you need to self-advocate and go to disability service office at the community college to show that this is something that she had, and to advocate, that these are supports that she needs in the school, or in college. So that is something that can be utilized, demonstrating that she needs these accommodations to be successful. But you have to self-advocate and go to the disability service office. And like I think one of the parents was mentioning, then they had a form, then they could take it to each of the teachers. This is what she, her disability, and these are just what she qualifies for in terms of taking her classes.
Even if it's a university and it's a private university?
Private, because usually like 504s are for people, and any institution that's receiving public funding. I'm not saying that you can't advocate, and hopefully they would have a disability service office and still go through that process. It's just like it's usually 504s is through when you're receiving public funding.
Okay, thank you.
We'll go ahead and wrap it up, and if people do have any remaining questions, you can certainly email me, and I'm in touch with our guest speakers, so I could always ask them to answer any remaining questions that you might have after the fact. But thank you all for participating, and thank you all to our speakers. Excellent discussion. It's a huge topic, and I think we covered quite a bit of it. So I do want to remind people, if you have any questions or need additional resources, please visit our website at epilepsymichigan.org or give us a call at 1-800-377-6226. So again, thank you to all of our speakers, and thank you everyone for joining us this evening.